Hello and welcome to a new episode of Medical Talk, where we bring you closer to the topics that truly affect our daily lives and mental well-being. Today, we are focusing on one of the most common yet often misunderstood challenges of modern life: work burnout. It's that silent, exhausting that slowly builds up through long hours, constant pressure, and the struggle to meet endless expectations. Burnout doesn't only affect our performance at work, it reaches our homes, our families, and even our health. In this episode, we will understand what burnout really is, how to recognize its warning signs, and most importantly, how to overcome it. Joining us today is Dr. Haya Almutairi, Senior Consultant Psychiatrist and a member of the Royal College of Psychiatrists in the UK, who will share her insight on how to protect our minds and restore balance in both work and life. Stay with us. We'll be right back after this short report on Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Haya Almutairi, a psychiatrist consultant. Dr. Haya, welcome to Medical Talk.
Hello, thank you.
Thank you so much. Your topic for today, God knows it's the most interesting and most important topic that everybody should talk about. Work burnout. It does not just affect certain occupation or certain people or certain personality. It affects everybody. But for a starter, can we give to our viewers what exactly is work burnout and why is it becoming more common in today's work environments?
That's very interesting. Work burnout is a person work mismatch, to simplify it. It is consisting of three factors: emotional exhaustion, sense of detachment, sense or feeling of lack of satisfaction because of exposure to prolonged stress, work stress. It's not becoming a new notion or a new interest. It has been there since many years, and I have talked about it maybe 15 years ago in one of the conferences. But the Western world became interested in it because after the compensation companies, they started studying which work groups are more likely to be affected by burnout. Nurses, teachers, people looking for geriatrics, working for care homes, or ICU, or dealing with cases that are very chronic. I'm not talking about the medical profession as well. So there is a pioneer in this field. Her name is Christina Masloch. She studied it and defined it as the erosion of the engagement between you and your work environment. It can be a precursor of depression because we want to prevent people from progressing to depression, and because we want to maintain people in their work and prevent dropouts. And work is very important, especially if you work for an institution. You're not self-employed. You are more exposed to burnout. That's why it's becoming more important.
Exactly. How can a work burnout affect person's performance and behavior at work? Because we can see there are two different things we're talking about: your performance and your behavior at work.
Exactly. If you are emotionally exhausted, if you feel detached, you are in a roller coaster or an emotion, you're not living in the moment, you are consumed. Not only at work, even in your family, motherhood, parents can feel burnout. And you have sense of depersonalization. You're not there and you don't feel satisfied. Of course, your temperament can be affected, your sleep can be affected, the time that you will seek absence from your work, the level of performance will be affected. So both behavior and performance will be affected. And you feel trapped. You feel helpless and trapped. So those are the behavioral and performance factors that can be affected if a person is in burnout or exposed to burnout.
Exactly. And so what are the early warning signs that shows an employee is like on the edge of burnout? This is, I think this is the responsibility of the manager or the leader of the institution, basically.
This is a very good question. One colleague asked me from the ICU that I was accusing him because I said, why you say case 1, case 2, bid 1, bid 2, you don't talk about a patient with their name in the ICU. And he asked me, Doctora, I feel I am invisible and everything is dehumanized. So we had a discussion, is this burnout or depression? Am I depressed? Actually a lengthy
discussion.
Yes, discussion. Burnout makes you feel detached. You're just like a machine. You don't feel there. You don't feel part of your work. And the early sign when you feel that you dread the week, the beginning of the week, you dread after the weekend, you dread it. You don't want to start work. And this is something that should make you consider and ask yourself, am I really going through burnout and what should I do?
Exactly. Now, working mothers in particular, especially in our society, those are trying to balance their jobs and the family responsibilities. How does burnout impact them, basically? Is it different than men, for example, working fathers?
Yes, yes, yes. Working mothers juggling with motherhood and employment with all its challenges and the high rate of depression or predisposed to depression in women. Women not being easily progressed to higher positions and having more autonomy in their work. Studies have proven that if you are a male, you are more likely to progress and be promoted compared to female due to biases and certain jobs. They need the qualities, the masculine qualities. So, and mothers feel always guilty.
Yes.
And they are ineffective as mothers. Also, parents, fathers do feel guilty and ineffective, but the culture expects the father to be a bread earner and the mother to be homekeeper.
Yes.
So both of them can be equally affected, but it does affect moms more. And also affect the whole environment, your availability with your children, your attention, your presence with your children. If you are burned out, exhausted, you feel you're not there, you're just a machine, you just feed the babies and go to work and come back and tidy the house and prepare the meals, and you are detached, you don't feel good about it. You don't feel good about yourself as a parent, you don't feel good about yourself at work. It does really significantly affect both.
Yes, exactly. It takes quite a lot from your energy and health and mental wise as well. And I'm sure you also agree that one factor is that if you don't see results for your work, basically, and you don't feel appreciated, basically, this basically like a precursor for
absolutely. Also, studies of burnout, they studied the reward system. They compared it with psychological studies conducted on gamblers. What makes gamblers gamble even if they lose? So they found out that if you are a boss, if you are a team leader, and you give your employees reward and incentives constantly, they will not increase performance, or the performance level is not going to be increased. But if it's sporadically,
then
unexpected, the level of performance increase. So having rewarded, having appreciated, hearing that, reading that, sending to your employers messages of appreciation, not necessarily a promotion or financial incentives, even praising them, having a time when at meeting when you validate the good work of your employers is extremely important. As a leader, as an employer, and as an employee as well.
Now, I think a lot of people now would appreciate why when you go somewhere you see a sign like the Employee of the Month. It's not meant for you, it's meant for them.
Yes.
And that's part of it. I have more questions. We're going to have to take a short break. We'll watch a short report and we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Haya Almutairi. Dr. Haya, before the break, we were talking about burnout and how mothers, working mothers in particular, can be affected with work burnout. Fathers, males in general, can actually experience burnout, but they will probably express it in a different way because...
Or tolerate it.
Exactly. Or may not even show
Put up with it, yes.
But it's quite serious because it could, it's like a ticking bomb, it could explode any moment.
Exactly.
I'm not going to assume anything. I want to get your expertise, your opinion on how the men's basically can actually experience burnout.
Burnout is a masked problem, masked emotional problem, and men are more likely to suppress their feelings. They actually can be judged if they complain and mourn or cry or express their feelings. They can be judged. So, and in our culture also, men are expected to tolerate more stress. Men are expected to not to cry if they lose a dear one. If they have a crisis. This is something only in our Arabic culture, unfortunately. Because of emotional suppression, because of lack of outlet to express that, because of mourning and talking and ventilation is not that much allowed for men. Of course, they can express it and it can be masked, and it can lead to winding them out, draining their energy and making them distant, and the cycle affects the whole family.
Absolutely.
Affects you being able to keep up with your work demands, and affects you being able to represent yourself and fulfill your fatherhood and family demands as well.
Exactly. It could affect your family, it could affect your colleagues, it could affect your patients and
relationship
or students, you know, colleagues, as I mentioned. But let's say like an early signs of burnout starting to show on a person. What are the basically immediately actions need to be taken to prevent things from getting worse?
Yes. It's important to recognize it. Time boundaries are very important. You have to not make yourself accessible throughout the day to your colleagues, to your employer, and even to your family. Don't look into your email regularly. At least people will expect that you answer your emails 4 times a day only. So they don't burden you with so many emails. Time boundaries are extremely important. Have a good sleep. Prioritize your sleep before you go to work, because it's pointless if you are drained and sleep deprived to go. Your performance will decline with time. Having exercise, the quality of exercise. I always ask people, why do you weight lift? Why don't you do something pleasurable, increases your serotonin, relaxes you, like swimming, like table tennis, simple things. This is very important to help you with the burnout. 10 minutes break at your work is extremely important. 10 minutes break to just relax. Have a space. Maybe if you know about meditation, meditate. Listen to the apps that they call them head space. Listen to music, listen to Quran. Just have a moment of silence. Take your break outside the work environment. Go in a walk, a 5-minute walk. This will help you. Plan a break. You have to take break. Some people, they save their leave until the end of the year. They don't take leave. Me, for example, I make sure, honestly, because my work really drives me to burn out, I take a break every other weekend. Even if I go to Khafji, I change the scene.
Just leave the environment where you are.
Yes, my mind stops thinking. I feel I'm in a different environment, disengage. I recharge, and I come back calm. And I can sense that. I can sense that. It's important for the person to be aware of his emotional derailment, emotional exhaustion, lack of detachment, feeling of that you're a machine. You're not having pleasure from everything. So you have to plan short breaks, short holidays. Time out, exactly, for yourself.
Time for yourself, that's what's important.
Yes.
You are a professional psychiatrist. When, in your opinion, is the right time or the necessary time to start therapy or even treatment for burnout?
If your sleep started to get affected, if your mood started to be down, no pleasure, if those breaks don't bring you back to feeling recharged and rejuvenated, this is a warning sign that you are heading towards some change of mood or mild depression. Physical symptoms, appetite, mood, lack of pleasure. But if you are still enjoying your breaks and your time out and your space for yourself, it's okay. But when it starts affecting, losing the taste, you should go for therapy.
After seeking basically the professional opinion by a psychiatrist. In your opinion, what can companies and organizations do to create healthier workplace and reduce burnout among employees?
Pre-employment should make sure that you fit the person. We said it's a person work fit. Fit the person to the right environment. Look for the characteristic. This is a girl who's hyperactive. She likes to be on the run. Why don't we put her on multiple locations? This is a very intellectual young gentleman. He is good with numbers, calculation. Maybe he should go for accounting. This is a person who has the skills with talking with people. Maybe HR is suitable. So fitting the people initially. And then rotation. Screening. Like big companies, big institution, they do screen. They send anonymous screen. You don't have to tell who you are, just to screen. Have you suffered from this? Do you find it difficult to stay? Did you lose your interest in your work? Do you feel drained? Are you detached? You have to screen. And then adjust the work environment. Counseling at work is also important. Some employers, they have the resources to provide counseling.
Exactly. So basically, that's what they mean by employee satisfaction surveys that they do. It's quite important. Dr. Haya Almutairi, I have so many questions, but unfortunately that's all the time we have. Thank you so much for your valuable time and all the valuable information that you shared with us. This is a very important topic. It affects all of us, obviously. No one is immune to burnout, because we are all dedicated to our work, I would assume. Sometimes that could push you to a burnout. Thank you so much for your visit.
Pleasure.
And hopefully we'll be able to host you again in Medical Talk. Thank you so much.
Thanks a lot.
Thank you. Dear viewers, stay with us. We'll be right back.
Hello everyone. Today I want to share with you some tips that keep your children's teeth happy and healthy. Oral care is not only about brushing. It's all about habits and nutrition and the regular dental visits. So now I will share with you some tips about the oral health. With regards to the daily routine, the kids should brush their teeth at least twice daily with an age-appropriate fluoridated toothpaste. So for the kids that are 3 and below, they should use a fluoridated toothpaste that has 1,000 part per million fluoride. And for older age, they can use a fluoridated toothpaste with 1,450 part per million fluoride. Also, they should floss at least once a day, and it doesn't depend on any age. Whenever you have a crowded teeth, you have to floss, even for a 1-year-old child. So the other thing is that spit and don't rinse at all, because the fluoride need times to protect the teeth. So don't rinse. The other thing is that for the parent, they need to help their kids in the brushing until the age of 7. This is really important. With regards now to the dietary instructions, the kids should have healthy snacks such as fruits and vegetables, cheese, salted crackers, let's say bread with cheese as well, and also, popcorn, for example. The other thing is that they should have water and milk instead of having fizzy drinks and acidic juices. Also, the kids should rinse their mouth after having a snack. The other thing is that the kids should go and visit the dentist every 4 to 6 months to make sure that they have the proper way of brushing. Also, to treat any cavities early instead of waiting for the pain, and also to protect their teeth from having cavities. Remember that oral care, not only brushing, but also habits, nutrition, and regular dental visits. Thank you very much.